I always wanted to be a doctor from very young. Even sort of 5, 6, 7, I knew that was the career I wanted to do. I remember I used to have a medical kit and I'd go out and, like, if a kid scraped their knee on the street playing football, I'd try bandage them up. So I was lucky that I knew very young that that's what I wanted to do. I suppose I wasn't a 600-point student in secondary school, and when I did my leaving cert back in the day, there wasn't an option to do graduate medicine. There wasn't a HPAT aptitude test. So the advice from my guidance counsellor was that, in a couple of years graduate medicine is going to open up, so to do a science degree. And I ended up going to DCU and doing physics, and after that I got offered a job in banking, so I took that for a while. Only about 6 or 7 years ago was I able to go and take the graduate medical exam and then go back into medicine. And it's never too late. I have some of the best colleagues that I have now at the same stage as me are in their early 40s and even older, that they've gone back to medical school as a mature student. And contrary to their previous career being an impediment, they've actually brought that wealth of knowledge they had as a school teacher or as a scientist, or even as someone working in forestry. They've brought that knowledge, that experience and all that soft skill set and all that maturity they have, they've brought it, and it's actually benefited them and it's augmented their skills as a doctor. And they're some of the best doctors I know. It can be a little bit scary when you think about going back and starting again and studying, especially when you haven't done it in a couple of years, but that's just the first hurdle to get over, and it can be done fairly easily. So I think if you have a vocation and a calling to do it, I think you should give it a go. Ultimately, your patients will benefit from your experience and from being maybe a little bit older and a little bit more seasoned. So when I was training to do medicine, and even last year when I was working at Dublin Hospital, I didn't really have any hobbies. I didn't really have any balance. The work-life balance was 100% work. But since starting GP training and moving out to West of Ireland, I've actually rediscovered a lot of my hobbies. So I've taken up golf again. I've started or rekindled my love of surfing. I've actually been able to make time for social engagements, for seeing friends and for seeing family. And all those things that I missed when I was working in a Dublin hospital, like weddings and baptisms and even funerals, I now have the scope to actually go and make time for those important things that kind of only come along once in a lifetime, and if you miss them, you miss them. So the balance is there as well, and I think that's really important, because it means that when I go back to work then, I have much more energy, I'm re-energized, and I can kind of give the best of myself to my patients and those under my care.